Siko Solo, nasema Siko Solo, nikitamka hilo jina la Yesu, yu karibu nami, yu karibu nami, yu karibu nami, yu karibu nami, yu karibu nami.
And welcome to the Siko Solo Podcast, a podcast aimed at creating mental health awareness. And here at Siko Solo, we're all about love, the good vibes, and spreading mental health awareness, making sure the conversation is heard. Mimi ni wako, Manolo.
And I'm Monari.
Yeah, and we are happy to bring you this content in partnership or courtesy of the one and only Blueberry Africa. Makofi kwa wale.
Blueberry Africa.
Makofi kwa Blueberry. Yes, of course. This is episode
2.
So 2.
Yep.
Mesha sawa wewe. This is episode 3.
This is episode 3. Nilikuwa sijamaliza episode 2 plus 1 is 3.
Tushaona venye ulikuwa unapita exam wewe. Tushakucheki. So welcome to episode 3. As always, definition time. Mental health. What is this? Mental health refers to unataka kucheka. I was almost sleeping. Mental health refers to the state of your cognitive or psychological, behavioral and kila saa patanga tu off guard and emotional, Monari.
Yeah, and
emotional well-being.
Niju umesema mental.
Mental health refers to the state of your psychological, behavioral and emotional well-being. And of course, again, a mental health illness or mental health disorder is now anything that's altering with this state of well-being. And now, therefore, eventually altering with how you do life.
Yeah.
Yebo, Monari, leo tunaongelelea nini hapa Siko Solo?
Mazeleo, first of all, we want to just say thank you to everybody who's been with us this far. We appreciate each one of you. And today we want to talk about a new topic.
Thought you'd appreciate me as well, but it's okay.
Heta kuja. Stay humble.
It's all right, Monari.
So we've tackled toxic workspaces and mental health. And then we've also looked at mythbusters, just demystifying. Is this true? Is this not true about mental health?
Yeah.
So now today, I want us to talk about
Niko Msoto.
I ain't got no money.
Yeah.
I got bills to pay.
Yeah.
I got things to think about.
Yeah.
I got,
Yeah.
I want us to talk about the high cost of accessing mental health services.
Exactly. For a lot of people, tumeona wase ndio how mind could get mental health assessment, how mind wanataka hizo vitu.
Yeah.
But those things cost iko so high. So mimi sina hiyo space kwa budget yangu. Yeah.
Definitely. So I just want us to talk about what the current situation looks like.
Yeah.
And what's being done. And where is this issue coming from? Like, why is it so expensive to access a basic need?
Yeah.
One of the SDG goals, I think it's number 3, is good healthcare.
Yeah.
So it should be something that's a necessity and accessible to everybody.
Yeah.
But then there's a big problem here in our country, Kenya.
Yeah.
With accessibility to mental health
and just
services.
how expensive it is. Unajua unasema healthcare ndio number 3, and I'm just thinking of how it's any conversation inaanzia na kuambia wase, first of all, mental health is a health issue in itself. Nobody wakes up na anasema I'm depressed. Nobody wishes this on them. It comes when you do the same way. You don't wish pneumonia on yourself, don't wish TB or anything. Sometimes it's not even caused by what you're going through. Sometimes it's caused by just chemical changes in the body, hormonal imbalance or some things like that. Sometimes it's caused by the environment. Sometimes it's caused by trauma, like you had an accident, and unfortunately you carried on that trauma. You went you're in the army for a couple of years, and you did a few campaigns, you did a few tours. A few tours, and then zina come na affect na trauma ina trigger maybe something like PTSD and so on and so forth. So nobody wishes this thing on themselves. And so conversation hapa kwetu inaanzia na this thing is a health matter
Yeah.
and it needs to be there. Nah, you'd think that, you know, people in that sector would know, but later on in this podcast you get to know that hata wase wako kwa health insurance hii ni kitu wajali sana.
Yeah. So we spent some time just going over some research material to find out exactly what has been done before, just to spearhead this conversation about costs.
Yes.
And Maze, I came across some interesting details. First of all, I don't know if people know that there's a Kenya mental health policy for 2015 to 2030 that exists. And that there was a mental health task force that was set up by the government just to take care of all matters mental health issues.
Yes.
So in this policy, it indicates that mental disorders are important risk factors.
Kakupata.
you got me
Usipite
there.
ni kama unaweza pita tu.
Let me just state that again.
Are important.
So this Kenya mental health policy, which is available online, indicates that mental disorders are important risk factors for other diseases, as well as unintentional and intentional injury. And on top of that, mental disorders increase the risk of getting ill from other diseases such as HIV, cardiovascular disease, diabetes, and other like chronic illnesses. So there's a large impact on individuals, families, communities, and as a whole, the nation at wide. So they are just trying to come up with findings on what has been done, what's accessible, and what was coming up in these reports was that, first of all, we only have out of the thousands of healthcare institutions in the country, there's less than 100 that can provide mental health care services.
Wow. In the country, nationwide.
The country, like nationwide, which is a dire case. We are 40 million people in this country. And to have those, like comparing 100 centers to 40 million is very unrealistic.
It's just crazy. The ratio is just off. Kwangu nime, naturally, ukisikia story na mental health, inakanga ni kama shida ya kibombe. Unajua?
Could you please define for me kibombe?
Inakanga ni kama shida ya mababi.
Oh, okay.
Inakanga ni kama na usijifanye wewe, unajua kwenye umetoka wewe, mora. Kilimani na kuchanganya aje. Anyway, inakanga ni kama it's such an upper class issue.
Yeah.
But that's not the case.
Exactly.
And a lot of people even in the common mwananchi, they go through these things, just that they maybe sometimes we don't know.
Yeah.
We don't know even we are going. Shida ni mingi mpaka hata ujui unapitia shida zingine.
Yeah.
There are some that take priority sometimes. So that being said, mimi nimeangalia kitu ya cost in a way I've seen it as private sector and public sector. Yani in that in the private sector there's so much that's being done. Yani we can name those facilities.
True.
Oasis Chiromo ilifunguliwa just a few years ago. Kuna Bustani, kuna kina Rakusei, all those things. You can talk about them they're in the private sector. Kama una do kweli huwezi saidika pale. And we don't blame them juu ni bees, the high cost of treatment. I know some of these places unaweza tumia hata mpaka upwards of 30k a day. 30,000 a day for treatment. 15k a day, there are people like Hisia Psychology, at the end of the day, hata kama some of these people, they have window, some few pro bono sessions. But you'll see that average session, say nakula maybe 3,000 average session, between 2k and 5k.
Yeah, that's true. But before we even go into the private sector, I just want to dwell on like what's made accessible by the government so far. The longest standing and most popular mental health institution is Mathare.
Public.
It's it's over 100 years old in existence, but yet the structures are dilapidated. It's just it's in a dire state.
Finish us.
Okay, kumeharibika.
Finish us, man.
It's in
Olive
a dire
barrels.
state. Yeah. And this institution is challenged by the lack of support from government in terms of funding, the lack of experienced and professional healthcare providers in the space of mental health. That capacity is lacking in that place. And even with those who are able to provide the service, there are not so many to cater for the number of cases that are being sent to this one center that is supposed to be serving the entire nation. So it's causing a challenge of accessibility in the way of you'd have to travel far and wide to just come in for a session. For a common mwananchi, that's a lot of money to be spending, already in a culture, in an African culture and setup where mental health is still a taboo subject. Ati nimekutuma Nairobi uende Mathare kuona daktari muongee kuhusu shida gani hizi.
No, utapelekwa hapo kwa alikuwa anaitwaje Karumanzira. Remember that guy?
I don't know what you're talking about.
No, like
who's that?
There are a lot of people when uko Ocha, they prefer the traditional doctors or say.
Oh yeah.
Lakini Monari surely Karumanzira.
I don't know. Imagine I don't know. I'm hearing that word for the first time.
When KBC was the only channel, were you watching?
No, I was doing my homework. Anyway, so
it depends on how you grow.
So there's a challenge in the public sector where there's not enough finances that are being channeled to mental health institutions, just generally to the mental health agenda. If we look at our health budget, I believe now we're at just 5% allocated
to mental health.
To mental
na
health
ilikuwa
activities.
2% actually. Then sai ndio wakaongezea with the formation of the task force that review ilikam na hiyo 5% kufikishwa 5%, but then at the same time bado hatuwezi sema hiyo 5% okay, but this is just my opinion. If it was spread out in kama Ministry of Education, mbona ana ka budget ka mental health ka sensitize kitu, ama kama wako nayo misijui, this is just my opinion. Ministry of Health wako nayo, yes. Ministry of Education ukiangalia sports ukiangalia hata prisons, mbona kuna umakarao, you know, when you look at all that, I mean ina need just, and I keep on saying this, the solution to this, and shout out to Odongo Danish, this is where I picked that from. The solution to this thing is mainstream mental health. Yani usieke place tu moja, skuma kila mahali. But unaona venye hata tukiongea juu ya private na ukiongea juu ya public itakani kama yani in a way ilisaulika kiasi.
Then there's insurance challenges. Not all institutions are taking insurance for mental health cases, and not all mental health cases are covered. Despite the fact that there's a mental health act that calls out discrimination against persons who are seeking mental health care. Services in healthcare institutions.
So this is something that can actually be pushed in parliament. A matter that can be pushed. But I mean, haijapushiwa.
There's very little. I think in our Kenyan system, we're very good at designing policies and documents, but there's so many bottlenecks to the action happening. It could be just a running culture of how things are run by our leadership, corruption, just misappropriation, and there's a lot of issues that are curtailing the ability for funds to be channeled directly to mental health care services being provided in institutions, and the support being allocated to them, and that's spreading out and not just being limited to national level 4, level 5 hospitals.
Yes.
But then it's going down to like mashinani community centers, to your local clinics, where there's far much more reach and closeness to interact with people. So that's what's happening in the public space.
I mean, there are some institutions, NGOs, and funding kutoka nje yenye imecome in pia inasaidia here and there, but it's not enough. And shout out to wase wenye wamejitolea. They've just come in to help sort this issue with mental health in our country, and just make sure that there is enough, make sure it's accessible to anyone, to the kids, to the grown-ups, and the cost is crazy. And even as we're talking about just the cost of any out-of-pocket payment, which actually out-of-pocket payment covers like maybe 43% of people when wana seek mental health wanalipa kutoka kwa mfuko. And I mean maybe that's your statistics naweza kuwa ni outdated, sa inajua maybe ni more because that's pre-COVID. I think apart from just out of pocket, even us as a nation, we take a hit because most of the people who are facing these challenges as a mental health issues and illnesses, they are the bigger part of the workforce. The youth, toka pale 18 mpaka around 35, and also wana face hizi vitu sana. And if you're having the bigger part of your workforce ill and they can't access help quick and affordable health quickly, then pia wewe as a nation una lose out. GDP yenyu inateka hit, and kweli GDP yetu imeteka hit even worldwide. Ile do wase wanatumia na ile resource na time wase wana lose wakijaribu kusukumana na mental health tunateka hit kwa economy sana. So see to out of pocket expenditure tunaangalia, but tunaangalia pia what we are losing as a nation. Sa zenye a lot of our youth are going through, manze, kwanza we've lost so much to suicide, yani man, manze.
I like that you're talking about what the cost variation looks like, because there's direct costs and there's indirect costs. So aside from what we're talking about as that 2,000, 3,000, 4,000, even upwards of 30,000 shillings to
per
access,
day,
to
per
access
session.
a session,
30k per session bili 60k. Man,
imagine a care session. We haven't talked about medication, aftercare. For those who are going into admission, just the cost of maybe paying for the bed, paying for your stay in hospital, and any other need you would require just to support your care in that moment. So these direct costs are many more than that surface consultation fee. Then besides that, you've talked about the indirect cost implication, where the people who are around you now have to take on the burden of caring for you, take on the burden of supporting you. And because you're not actively working, then you're also losing out in generating income, in building yourself in a way that now in a large scale contributes to our economy. So it's a big challenge. And I keep asking myself, well, fine, there's a lot of private institutions that are available and are offering mental health care services, but that consultation fee that generally ranges between 2,000 and probably 6,000 shillings, is that accessible to a common mwananchi, that you would pay out of pocket and not feel a pinch for every single session you attend? I still think that it's very inaccessible. It still feels like a luxury service.
And also just coming in even to our employers. I mean, I've seen companies whereby maybe a department takes a huge loss. Maybe you lose 2 or 3 people within a year, and so they bring in someone to, just a therapist to talk about grief and just talk about how to process that with the team. And they pay that out of their budget, and I find that very thoughtful. It's just next level, and not so many companies are open to that. So bado hata ukienda job huwezi access hiyo kitu. Thinking about schools, even the private schools, leave alone even just private schools, we just look at them zote pamoja. Schools will spend money to bring in guys to talk about motivational speakers. They'll spend cash on bringing guys to talk about careers. They'll spend money bringing guys experiences. Yes, they'll open doors to people to come and talk, to see you, to school missions with church groups. But rarely will you find a school that's opening doors that has deliberately sought out to bring people to talk about mental health. And so kuna kazi ya kufanya.
Definitely. As we wait for like the grand scheme of policy changes to be made and that action to be taken, I think there's things that people can do on the ground that sort of think of them as interventions, and there are people who are actually running those initiatives to sort of bridge this gap between an expensive consultation and one being able to get necessary help.
Yes. Yes. And man, that's what it looks like. But all hope is not lost. Sindio? I mean, hata kama inakaa hivyo sahi, kuna wasee wenye wame come up, and even our own government bado kuna vitu zime come up ni like rays of sunlight pale kwa end of the tunnel. And we're going to be discussing those things when we come back. But right now, get to hear this message from our sponsors of this episode. We'll be right back. Usiende mahali wewe. Unaenda wapi?
Don't go further.
Unaenda wapi?
Hey guys, my name is Steve Mutua and I'm a podcast producer at Blueberry Africa. So Blueberry Africa is a podcast production company located in 95 Riverside. Blueberry Africa started in 2020 at the height of the pandemic. We've since endeavored to make podcasting affordable and accessible. This is through strategic partnerships. We have partnered with a PR agency so our clients get a good package for PR services. We also have introduced different packages where someone gets to book for the needs that they feel suit their podcast. This has given rise to many storytellers. The booking process is so simple. Just check out our website www.blueberrystudio.africa. You can check out our rates. After checking out the rates, select a package which suits your needs. Then fill in the pop-up form or call 0725 108 407 and someone will be able to revert back to you.
Welcome back to the Siko Solo Podcast, our podcast, of course, aimed at mental health awareness. It's here for you, it's here for me, it's here for all of us. Na leo, mimi Manolo and
Monari
tuna discuss juu ya Niko Msoto, man. Niko Msoto, manze. I don't have enough cash to seek out or to pay for sessions to pay for mental health services here in Kenya. And we're just talking about the high cost that has been and the situation. That's what we were discussing before we went on break. The situation vile inakaa, vile inakaa kuna demarcation very clear. The private sector and the public. Private inakaa kena do poor, in my opinion. But they can do better. Na public inakaa ni kama inaumia, nika ilisaulika. We've talked about the policies that are there. What the government has done so far. We've talked about the task force. We've talked about the budget allocation going from 2% to 5%. And just before we went, we promised you that when we come back, we're going to talk about what's happening, what's being done now on the ground. Ku bridge hii gap ya cost na common mwananchi. Cost ya mental health na common mwananchi. Yes, Monari.
So, there's a number of organizations in the country that are trying to bridge that gap of access. So some are willing to sponsor individuals access services. Some are running community-based recovery-oriented services such that they bridge that cost of having to do individual sessions when they can cover a larger group of people at a community level, so just pulling together experts in the field and going down to homes, communities, social groups, unions, such spaces and gatherings to be able to address the community. And in one way or another, one is getting indirect help, but that's necessary and helpful. We are also seeing a rise in, because of social media and just all these campaigns around mental health, we are seeing a rise in people being able to share and express their stories and their journeys. And that, in a way, it may not be visible, but in a way is kind of helping people access some form of help.
Yeah.
Just knowing that, one, you're not alone, and this is how someone else pulled through this situation. I can be able to come out of it.
Yeah.
So there are people who are getting some form of help, some form of uplifting or encouragement, in as much as they're not able to or afford access a mental health service or treatment. There's tech innovations in the form of service delivery that are available today. There's one that's known globally called Better Health that allows people to select and decide with specific therapists the kind of sessions they'd like to have, and one can do so at the comfort of their own home, of course at a cost, but it's largely subsidized compared to having to take on a physical session.
It's accessible very easy in that unaweza engage quickly.
You can engage online, but this is also dependent on your ability to having internet and stuff like that. There's a few Kenyan platforms I've heard of. Nisikize, that's being run by Miss Kendi Ashitiva. It's an on-call basis therapy service. You're able to reach out and you'll get a therapist linked to you. There was a platform that was being run for some time called Bonga that allowed people to anonymously access therapists and get help immediately. So these kinds of forums and efforts in many ways are bridging that cost implication of having to travel to see a therapist, to book a session, to pay, those costs that slowly pick up and add up with time. And I think the most successful so far has been community-based or community-driven to target groups initiatives. There's an institute called Shamiri that's doing a fantastic job in schools. So they use behavior science techniques to sort of provide mental health information and awareness to young students. And out of their research and analysis, they've had success stories. Analysis. They've had
post-production.
They've had success stories out of that, So where it would have costed about 10,000 shillings per child, it's such a subsidized cost because of how they've designed their program, which is a good initiative.
Exactly. Looking at that, I'll also look at, there's always room for improvement. Kuna inakuwa 99%, kuna ile 1% inaachwa ya ongezea. And I feel like we can do better. We still can do better. The ideas we can come up with zinaweza saidia sana. One of the ideas we were just discussing off cam is private sector kama ina thrive. I mean, kama kuna say, and I know the price is at that. Your 30k to make profit. I know the price is there because of the high cost of
providing that service,
providing the service, medication. You need to have some of these patients. You need to have them on board. Like lazima wakwe boarding na wewe hapo. You have nurses. You have a space you're paying for, and there's a high cost.
Facility charges.
Ulienda shule wewe mwenyewe, psychologist miaka yako, psychiatrist, ukachapa kitu, clinical psychologist, ulienda chuo, so you also need to have a career as well. But we were just thinking of how there can be like a surplus kidogo, and then so if you're charging 30 Gs, it will take sacrifice. If you're saying maybe from every session you'll take hata ka utatoa punch,
Yeah.
akilipa 3,000 unatoa punch, hiyo punch itaenda kuketa for like a pro bono
Yeah. Sessions,
for pro bono sessions zenye unaweza provide to the public.
Yeah.
Inaweza kuwa kitu poa sana. We are also looking at just creating a place where there are many therapists wenye wako hata kuna wenye hata practice per se, ama kuna wenye wako na some hours zenye wanaweza peana zenye si billable.
Yeah. Yeah.
When you create platform yenye hao wote tunaweka, what are you willing to give, wako willing to give nini, wako willing kwa leta na kuprovide hiyo kitu to the public, kujua naweza access hawa watu hivi na hivi na hivi. No?
Very true.
And it also calls for just even as a country, as a nation, push to have more professionals in the public sector, more professionals. Like tukiangalia an ideal situation whereby every public hospital icona like 2 or 3 clinical psychologists. Inaweza kuwa fiti sana. But I know it's ni process, ni kitu take a while, but ni kitu the first step tu ndio tuna need. Tukianza tumeanza na tumesonga nayo.
Definitely.
Yeah. And of course as well ni kupush our leaders, man. Kupush our leaders kuona that they need ini kitu wana need kuwekea kuweka into consideration sana. Na ni kitu wanafaa is something that they're supposed to really allocate funds to, but not just allocate funds and leave it like that, but yani hizo funds zifikie wenye zinafaa kufikia, zifanye chenye zinafaa kufanya. And so ni a lot more can be done. I don't know if you have anything to add on to that, Monari.
I think for me, my biggest takeaway from this conversation is now we know that this is the current situation in the country. And we know what it looks like to access just a session. And how much that would cost a common wananchi. So for me who is passionate about mental health and can in one way or another access people who are experts in the field, I'm charged to raise the questions of what are you guys doing to mitigate those costs? How can you plug into this conversation and offer help in one way or another? What can you do with your expertise? What can you do with your hours? What can you do with how you charge your sessions to be able to make it a little bit more accessible? Even if it's to just a handful of people, it's better than nothing, know.
And definitely, and for us at Siko Solo, pia kuna vitu tumeandika tutafanya concerning this episode, and we hope to you'll see that going forward. But there's hope, and let me just put this out there. When we talk about these things, we may refer to Kenya because that's where we are, but the cost is high. It cuts across. Even in America, there's high cost. Even now, kuna zile 1-800 calls and all that. But there's some helplines that you can call. But at the same time, it's still very expensive for the common person kwenda ku access mental health services that are affordable. So it's siati tunaangalia tu Kenya tunasema tumeisha. No. It's happening in other places as well. So wherever you're watching us from, there's something you can do about that state in your country. Yes, but thank you for being with us. And mpendwa mtazamaji, sasa tumefika kwa kipengele, yani kitengo moja kwa this podcast of ours ambayo ni this is just mind games. Tunataka tujue nani mjuaji na nani gazeti anatumia kuwipe tu dirisha peke yake kwa hii skodi yangu. Gazeti ni ya Mira pekee.
Manolo anajichocha hapa, my friend.
So anyway, welcome to the mind games. Let's go. What is always coming but never arrives?
Wow. What is always coming but never arrives?
The sun.
Time.
We stay. Come, we stay.
Tomorrow. Tomorrow.
What do you even mean by that? What is always coming but never arrives? Tomorrow.
Checky, can I finish that statement as the winner? It's tomorrow. Thanks.
Let's go. What starts with an E and ends with an E, but only has one letter in it? One letter in it.
I.
Hey.
E. I-Y-E.
E and ends with an E, but only has one letter in it. E.
That sentence.
It starts with an E, ends with an E, and only has one letter in it. Letter E.
Ew, the E-W-E.
E and ends with an E, but only has one letter in it. E exclamation mark, the channel. Time is up.
Envelope. The envelope.
Oh, man. I didn't see that one coming. One letter. Mind games.
One letter.
Wasted. How many sheep did Moses take to the ark? None, because it's Noah who took stuff to the ark. At least manze nilikuwa nimeonikisha kasi sijapata manze nitasikia mbaya.
I was caught off guard.
Were you thinking about it? Pastor Monari. Pastor.
If you don't get it, forget about it.
Turn me on my side and I'm everything. Cut me in half and I'm nothing. What is it? And the answer is a number. Turn me on my side, I'm everything. 1. Number 1.
8.
Oh.
I ate that.
Turn me on my side, I'm infinity. Then cut me in half, I'm 0, 0. Hiyo tumepatia.
Hizo scores zimefika wapi? Who's winning?
3
1.
3 hapana, amepata 2.
3 1.
Hapana ni 2 1.
Yeah.
Amepata 2 pekee.
No, I got the first one.
She got the first one.
Tomorrow I got 8.
Nini ingine umepata?
I is technically correct.
Wacha envelope bwana. Ni nini bwana? Ni nini wewe?
Lakini bado ni 2-1.
What word is spelled incorrectly in every single dictionary? Incorrectly.
3-2.
But okay, fine. 3-2. Let's go. What are 2 things you can never eat for breakfast? Lunch or supper? True. Oh my God, did I hear 3-3 in that place?
Oh my gosh.
Emotional damage. Yes, let's tiebreaker. Let's break this thing.
Kichwa yangu ilikuwa imeenda kwa mugali na
Ndoma. Cassava. Let's go. If you have 1, no, repeat with me. You are thinking instead of repeating.
If you have
me.
1,
you have to share it. But if you share it, you have none. 1.
None.
If you have 1, you have to share it. You want to share it. A wife, a spouse. No, ukiwa na yeye akikubo unataka umpeane, ukimpeana hauna. Hiyo kitu ni, that's a valid answer.
Cake. you can't have
if you have a hat. Money.
Life. Yeah.
If you have 1, you want to share it. A hat. I give you my heart. But then when you share it, you have none. Okay. If you have 1, you want to share it. If you have none, if you share it.
Once you share it, you do not have it. What? No, that's not the answer. It can be. It cannot be.
It can be.
It cannot.
Give us a hint.
No.
Snake poison. Wajakoya the fist. Snake poison. Okay. It starts with an S. Sleep.
A smile.
Sleep. No. What am I even saying?
Once you share it, you can't.
Share.
Secret. Kuna siri ya watu wawili.
Sorry.
Okay.
What has cities but no houses? Forests
but no trees. And water but no fish.
The ocean.
Cities.
Houses but no?
It has cities but no houses.
Uh-huh.
Forests but no
Maps.
Map.
Google Maps. Yeah. Thank you very much. I would like to thank my parents for the opportunity just to go to school and just to kuweza kufikiria vizuri ili nije nishinde the girl child hapa. Yeah.
Wow.
I'd like to thank all my mentors and everyone who's brought me to this, everyone who's held my hand up until now. For my losers, for the losers, for the losers, you wait until the next episode. You might actually thrive. What has houses but no trees? Has
but on Google
water
Maps,
but no
there are
fish?
trees.
Forest. Unaona sasa why are you being a so loser? Oh, they rigged. Oh, yeah. Just lose, man.
No, the answer is navigation, not maps.
It's geomaps,
you
man.
See the river, you see.
It's geomaps, man.
You see fishes in the river.
Yeah, Monari bwana.
The question has a problem.
Monari
I'd like
bwana.
to submit that this question has
Monari
a problem.
bwana.
Sure,
Monari.
there's a problem in
You go and
question
appeal
5.
somewhere else. Go and appeal somewhere else.
Ni sawa tu. Next time I'm coming back and I'm gonna win.
Ni nani?